Good evening, everyone. I'd like to call our meeting to order. This is a special meeting of the LaPorte County Commissioners, Wednesday, April 8th. Let's have the Pledge of Allegiance next. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call, please.
So if I say Rich's name, does he say here? Right?
Mm-hmm. Yep.
Oh, is she going to do it?
Roll call, Mrs. Winsky.
Here anymore. Okay. Do I do it?
Go ahead.
Okay.
Go ahead.
Commissioner Cora?
Present.
Commissioner Matias?
Present.
Commissioner Morozinski?
Can hear you.
I think that was a here.
You have a quorum.
Thank you so much. Next on the agenda, we would like to consider this evening's agenda. Are there any additions, corrections, or deletions?
Madam President, I make a motion to... Madam
Squeaky noises.
Okay. I make a motion to adopt the agenda as presented.
They're muted.
Thank you. Those of you who are Zooming in, if you could just all mute your microphones until you are ready to make a comment or address the commission. Thanks so much. So we have a motion on the floor to adopt the agenda as presented. All those in favor signify by saying aye.
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 Thank you. Aye. The motion has passed. We now have our agenda. Next on the agenda, consider the adoption of the amended LaPorte County COVID-19 Employee and Operations Policy. This has been work that Barb, our HR director, has been doing with our COVID operations team, and we want to be sure that we present this so our employees understand what we are doing to take care of everyone. And then we have department heads that are Zooming in who may not be present, who may have questions. So, Barb, if you could give us a presentation, that would be wonderful.
Sure. As you had mentioned, we did amend the LaPorte County COVID-19 Employee and Operations Policy. In response to the coronavirus pandemic, Congress did enact a bill providing various forms of relief, including 2 separate laws mandating that employers give employees paid leave for specified purposes relating to the COVID-19. The 2 leave laws are the Emergency Family and Medical Leave Expansion Act and the Emergency Paid Sick Leave Act. These mandates take effect April 1st through December 31st of this year. The Board of Commissioners are amending the Employee County COVID-19 Employee and Operations Policy effective April 1st of 2020. Modifications to our normal operations. While our primary goal has been to keep operating as normally as possible for as long as possible, county offices closed to the public for all non-essential business on March 17th of 2020. Departments have enacted social distancing practices, separation of at least 6 feet where possible, and this has led to limits on public interactions for all departments with an emphasis on email, phone, and fax. Number 1, declare a public health emergency effective March 13th of 2020. Number 2, direct elected officials overseeing county departments and department heads to implement a plan to allow essential county offices and departments to remain staffed and operational, utilizing full-time and part-time employees, but under the following guidance. A, allow county employees as determined by their supervisor or department head to work remotely if possible through and including April 20th of 2020. Those working remotely should continue using the timesheets that have been provided to record time worked remotely. B, county departments shall continue to operate by utilizing a rotational schedule during working hours to keep the individual departments operational through and including April 20th of 2020. Number 3, all county buildings except the courthouse shall be closed to the public through and including April 20th of 2020. Security at either courthouse will monitor and inquire of members of the public as to whether they are presenting at the door for essential businesses, including any court hearings. In the event of complete closure of county facilities to employees, all non-essential personnel will be placed on an Emergency Family and Medical Leave Expansion Act as if they meet exception number 5, which is listed under the Emergency Paid Sick Leave Act. Essential safety personnel who must report to work during these extreme conditions may be eligible for additional benefits yet to be determined. This policy is subject to modifications by the Board of Commissioners. Changes in policy will be communicated to employees via the county's email system. And I present that as the amended policy.
Thank you.
Madam President, and members of the commission, Barb's office has worked with mine to modify the operations policy that you previously adopted so that this is now consistent with the federal acts, and also updates in terms of what your operational direction is to departments. As you recall from the very beginning, you said, look, we're going to provide discretion to department heads and elected officials to assign individuals as needed to perform essential functions. Those who can work from home should do so, should maintain use of the timesheets. Those who need to be in the county buildings should do so as well. Many times you're staggering scheduling, which is exactly what you've requested. So this simply puts in policy form the kind of direction that you've had and then updates it to be consistent with the federal policy.
Thank you. Are there any comments or questions from department heads that are on here virtually?
Madam President, I make a motion to adopt the revised, the amended COVID-19 employee and operations policy.
Second the motion.
We have a motion and a second. All those in favor signify by saying aye.
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 The motion has been passed and the policy has been adopted. Next on the agenda, we have the consideration of the adoption of the FMLA leave expansion and emergency paid sick leave policy. Ms. Mawson?
Thank you. As Mr. Friedman indicated, I have worked closely with his office to put together policies for the county, and I am going to go ahead and read those through what we have come up with. So to comply with the Family First Coronavirus Response Act and to assist employees affected by COVID-19 outbreak with job protected leave and emergency paid sick leave, this policy will be in effect from April 1st of 2020 through December 31st of 2020. Our existing FMLA leave policy still applies to all other reasons for leave outside of this policy. In general, the Emergency Family and Medical Leave Expansion Act amends the Federal Family and Medical Leave Act, which is FMLA, to allow employees to take leave for certain child care purposes related to COVID-19. All employees who have been covered with LaPorte County government for at least 30 calendar days are eligible for the new FMLA leave. Emergency responders and healthcare providers may be exempt from this policy. We have identified emergency response providers as law enforcement officers, correctional institution personnel, EMS personnel, public health personnel, EMTs, paramedics, emergency management personnel, 911 operators, and persons with skills or training in operating specialized equipment or other skills needed to provide aid in a declared emergency, as well as individuals who work for such facilities.
We should clarify, as Barb and I have talked, we found that the new act does not cover these law enforcement officers, correctional EMS, and so it doesn't mandate coverage, so it is discretionary with the governmental unit about providing that paid sick leave if in fact an issue arises. It is just that it is unlikely then we'd get reimbursement on that from the federal government, but knowing how this commission feels about wanting to make sure that your first responders and security personnel are fully covered, we've made it discretionary in here so that you do have the option to be able to do that.
Reason for leave: eligible employees are unable to work or telework due to a need to care for their child under the age of 18 years of age when the school or place of care has been closed, or the regular child care provider is unavailable due to a public health emergency with respect to COVID-19. A child care provider means a provider who receives compensation for providing child care services on a regular basis. Where the need for leave is foreseeable, employees should provide the county with as much notice of leave as practicable. Duration of leave: employees will have up to 12 weeks of leave to use from April 1st, 2020 through December 31st, 2020 for the above stated purposes. This time it is included in and not in addition to the total FMLA leave entitlement of 12 weeks within a 12-month period. For example, if an employee has already taken 6 weeks of FMLA leave, that employee would then be eligible for another 6 weeks of FMLA leave under this policy. Leave will be unpaid for the first 10 days of leave. However, employees may use any accrued paid vacation, sick, or personal leave during this time. The employee may also elect to use the paid leave provided under the Emergency Paid Sick Leave Act to cover those first 10 days. After the first 10 days under this new provision, the county must pay at least 2/3 of the employee's regular rate of pay based on the number of hours the employee would otherwise normally be scheduled to work. Pay will not exceed $200 per day or $10,000 in total. Any unused portion of this pay will not carry over to the next year. All employees requesting FMLA leave must provide written notice where possible of the need to leave to the Human Resources Department as soon as practical. Verbal notice will otherwise be accepted until written notice can be provided. Within 5 business days after the employee has provided this notice, Human Resources will complete and provide the employee with any Department of Labor required notices. The notice the employee provides should include a brief statement as to the reason for leave and, if possible, the expected duration. The second part to this new act is the Emergency Paid Sick Leave Act. The second law passed providing paid employee leave in relation to the coronavirus in the Emergency Paid Sick Leave Act. All employees, regardless of their length of employment with the county, are eligible. Emergency responders and healthcare providers may be exempt from this policy. All eligible full-time employees, regardless of the length of time that have worked for the county, are entitled to 80 hours of paid sick leave available for immediate use for the qualifying reasons listed below. Part-time employees are entitled to the number of hours worked on average over a 2-week period. Paid sick time may be taken when the employee, 1, is subject to a federal, state, or local quarantine or isolation order related to the COVID-19. 2, has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. 3, is experiencing symptoms of COVID-19 and seeking a medical diagnosis. 4, is caring for an individual who is subject to either number 1 or 2 of the above. Number 5, is caring for his or her child if the school or place of care of the child has been closed or the child care provider of such child is unavailable due to the COVID-19 precautions. Number 6, is experiencing any other substantially similar conditions specified by the Secretary of Health and Human Services in consultation with the Secretary of the Treasurer and the Secretary of Labor. The rate of pay. Paid emergency sick leave will be paid at the employee's regular rate of pay for leave taken for reasons 1 through 3 above. Employees taking leave for reasons 4 through 6 will be compensated at 2/3 the regular rate of pay. Daily and total maximum limits apply as set forth in the compensation table that is included with this policy. Special calculation rules apply for part-time employees with variable work schedules, average pay based on previous 2 weeks of pay. If an employee has not worked for a period of 2 weeks, the county may average what the employee would have been normally scheduled to work. The employee may use emergency paid sick leave under this policy before using any other accrued paid time off for the qualifying reasons stated above. The county may not require the employee to use other paid leave before using emergency sick paid leave. Employees on expanded FMLA leave under this policy may use emergency paid sick leave during the first 10 days of normally unpaid FMLA leave. Additionally, employees may not use any other paid leave in addition to the emergency paid sick leave to compensate for the 1/3 of wages not paid. The procedure for requesting emergency paid sick leave. Employees must notify their elected official, department head, or human resources of the need and specify reason for leave under this policy. A form will be provided to all employees in a manner accessible to all. Verbal notifications will be accepted until practical to provide written notice. Paid emergency sick leave under this policy will not be provided beyond December 31st of 2020. Any unused paid sick leave will not carry over to the next year or be paid out to employees. Employees are not entitled to reimbursement for unused leave upon termination, resignation, retirement, or other separation from employment. And as I indicated, we are also including a graph with that to help employees and the employers or department heads figure out where information falls at with what the employee is going to be doing. And then we also have been provided by the Department of Labor posters that we are going to be sending out to have all our employers post those throughout all departments. Is there any questions on all that? I know it's a lot.
And just some clarification too. I mean, we were both concerned as we read the act that law enforcement officers, EMS, public health, EMTs, paramedics, emergency medical are not automatically able to access this. The theory, I think, being they're all critical, keep them on the job, don't provide some kind of leave provision, or at least don't mandate it, whereas this way we want it discretionary, because I know how strongly all three of you feel about the need to care for those personnel just as much as other personnel working for the county. So that's why it's left as discretionary, so that you're able to award it if in fact the need arises in a particular department.
And right now, this policy is only set to go through April 20th. So at that point in time, if we need to extend this further or make any adjustments, other adjustments to the policy, we'll need to do so at that time.
But the operations policy, I think
Yes.
that's right. The emergency and paid sick leave policy is actually in place from April 1st, 2020 till the end of the year.
Yes. And
Barb, I have a question. This is quite extensive and a little bit confusing, you know, especially how these interact with each other. Of course, this we have to adopt it because it's a policy, but if
And Doctor, I want you to know this is the revised, simplified version. I mean, we have gone through,
we cut it down from like,
believe it or not, I mean, I know it is.
A lot.
We said the same thing. This thing has to be understandable.
Right.
And so we've tried to simplify it as much as possible because you got the interplay of the two acts. But I hear you. We were concerned about that as well. I'm hoping the chart, we both hope that the chart that is with that will help employee and department head understanding as well.
all right.
And I'm always available too for questions, because I know I'm still going through this. There's still questions that are coming up. One item in with this is that the Department of Labor has not provided us with any forms to address this, so we are making up our own as we go through. And then the other matter with the substantially similar conditions specified by the Secretary of Health and Human Services, they have not provided us what those are. So it's still a very fluid situation, and I'm still waiting to get more information from them with regards to this policy.
And Doctor, if you'll look at the chart, we've even simplified the chart, but we think it will help department head understanding a great deal on how the two acts interplay and how folks can then access leave. At least that's the
Sean, philosophically, I feel things have been simplified if we can get it on a 4x4 card.
That's going to be tough. How big of type can I use, or how small?
So, because you'll get calls from employees and department heads because, so that's the reason I'm just suggesting to you to maybe even simplify it a little bit more. That way you're ready to answer those questions.
Yeah, and I feel right now that I am prepared to help any department head or elected official.
Barb has done a tremendous job. What we try to do was pull the best of the best from some other policies, some other jurisdictions. We try to simplify it down. This is about the fourth or fifth draft, I think, of what we've come up with. But your point is well taken.
Thank you for doing it. It's very complicated, and you have done a great job simplifying it, but maybe a little bit more as we go.
We're going to try color coding, Doctor. How about
So one of my suggestions to that point is if you could create some scenarios. So a lot of department heads, you're going to find that they're going to be calling you with the same question.
Okay.
Yes.
Yeah.
So if you did a FAQ that said,
Yes.
you know,
I think it's a great idea.
if this is the situation, here's the answer. So
Yeah.
because you're going to be inundated, and I guess the other thing that I want to mention is that I think we want our employees to hear loud and clear that our job is to make sure that they feel safe and taken care of. And so when you're doing that counseling, if you can make sure that that comes through loud and clear, because I think as a county, you know, right now some folks might not have a heavy workload, but it's only being held in the queue, and when we come back to work, there's going to be more than enough work, and it's going to be hard to catch up. So we want to make sure people know that we're concerned about their health, they're concerned about their families, and we want to take care of everyone. Okay. So thank you.
I make a motion to adopt the FMLA leave expansion and emergency paid sick leave policy.
I'll second the motion, sir.
Thank you.
We have a motion and a second to adopt the FMLA leave expansion and emergency paid sick leave policy. All those in favor signify by saying aye.
Aye.
The motion has been adopted. Next on the agenda, we have considered setting a date for a joint workshop with the County Council to discuss unified request for additional appropriation to pay for non-budgeted personnel protection equipment, also known as PPE, supplies, materials, extra hire, and any overtime required to assist LaPorte County government personnel during COVID-19 emergency. I would also add that we want to circle with the County Council at that meeting on the courthouse project.
Madam President, if it works for the council members and Commissioner Brzezinski, maybe we can do it from 5 to 6, like the hour before our regular commission meeting, which is scheduled for April 15th.
We can propose that. One of the things that you've done, and fortunately both Commissioner Matias and Council President Novak sent correspondence out to all department heads asking them to get you best estimates for their department's needs to assist up to 6 months down the road for both PPE, emergency supplies and material, extra hire, or rather anticipated overtime was the third item I believe that you had asked for. You were asking specifically for estimates on non-budgeted items, and so I think they're to return that to both Diane and to the auditor by this Friday. And so you'll have information that you can then discuss in a workshop with the council, hopefully come the 15th then.
Right. So I guess I think it's important that the public know that this isn't an emergency request because we don't have anything. Our departments, and I'm sure Commissioner Brzezinski and Commissioner Cora would agree with me, our departments, and in particular a few people like Andrew McGuire at EMS and Larry Butcher at EMA, Larry Lewandowski, Health Department, they have really done a yeoman's job of making sure that we have every possible supply that's out there, that's accessible, that we have it. What we want to do, though, is be sure that we are not just thinking about today or next week, that we have a long runway as far as supplies and materials go. So we're not finding ourselves in situations that we've all seen on the media where people are, they're really in a really world of hurt. So we want to anticipate, and we're asking our departments to think of this as a 6-month project. And so the goal of the Friday deadline is that they send us their needs so that they have 6 months supply of the things that we just mentioned that are necessary for health and human safety.
Madam President, my comment is, as we saw this whole situation unfold, we realized how unprepared we were in various aspects, especially when it comes to testing and PPE. So I think learning the lessons from the experience of what has happened in New York and trying to anticipate our needs and be prepared for it is a wise thing to do. Some of the members in the health department asked, it's hard. I said, I realize it's hard, but just do the best you can to coming up with the estimates. And for some reason, let's say you get some PPE, and if it is not utilized, it's not that it's going to expire tomorrow. I mean, you can continue to use it over the following 6 months. And so I think that's the approach we need to take. That way, we are not caught off guard, and we are prepared to handle any emergencies. Thank God that most of the folks in LaPorte County have heeded our call, and they're trying to stay home. Fortunately, the numbers in LaPorte County so far are not too bad, and we have been able to handle it. And then I'm going to encourage everyone to continue to do that. But in case for some reason there is some hot spot that develops and we have to respond, we need to be ready for it.
Great. So we have a consideration on the on the agenda to set a date. We're setting a date for April 15th, or that's a suggested date.
Good. I think we hadn't had a chance to hear from Council President Novak on what days, but at least...
But if it works for the council member,
Right.
President Novak and
So
others.
I have had, on my way here, we had a little bit of a conversation, so it was next week, and I think Wednesday, 5 to 6 should work, and maybe Diane and Darlene can help us set that up via Zoom. Do we need a motion, or do we just...
No, I think just notifying that that's
Okay.
the intended date will be fine, and that we can do the formal notice
Okay.
that's required.
Great. All right, next on the agenda then.
I sent it out to everyone.
Oh, there you are. Oh, good.
I'm hoping that date works. I think it should.
Okay.
Okay. Yeah, if
Great.
for some reason, President Novak, if it doesn't work, Mr. Novak, we'll try to figure out another day. But if it works, then I think we can get it done on the 15th.
I'm hoping we can get it set up,
Yeah.
especially for a Zoom meeting.
Yes.
Yeah, perfect.
Thank you.
Thanks so much, Council President Novak. Next on the agenda.
Hey, Commissioner, may I say something?
Yeah, it's Matthias, by the way.
Matthias, darn it,
I know, it's hard.
I know. No, but I just want to remind Randy too, because I know you guys added the courthouse discussion to this, and I believe at our last workshop meeting, whatever, we had wanted to see if we could put that in an executive session. So I don't know how much we want to discuss, the courthouse in a workshop where I believe it was the consensus of the council to do it in a executive session.
We've already discussed that with your attorney, and there's not a basis under the statute to convene it as an exec session, so we'll simply have to do it as part of the public workshop.
Oh, okay, Shaw, thank you very much, because at that time, he was going to look into it. We haven't received that information back, so that answers that question. So, okay, we just haven't gotten that email to us or what have you.
Gotcha.
Thank you.
Thank you.
Thank you. Next on the agenda, we have Commissioner comments. Commissioner Merzinski?
Good with the meeting on the 15th. Everybody just hang in here, keep doing what you're doing. We're all in this together, and we'll get through it.
Thank you.
That's wise comments. Commissioner Cora?
Now, I echo Commissioner Mrazinski's thoughts that we, so far, as I mentioned earlier, things have not been too bad here in our county. For those folks who are listening or watching it on TV, we have had 29 positive cases in our county so far, and unfortunately we have had 3 fatalities related to COVID. I have been told by some individuals that some people still don't take this seriously in spite of what has happened across the country, and especially what has happened in New York. Some people are still thinking this is just a simple flu. I just want to emphasize that this is not a simple flu. This is a very vicious disease. Yes, some people have very minor symptoms, but for those few individuals who get severe symptoms, it's brutal. It's brutal. Basically, the lungs get all white out. They can't breathe, and they have to put on a ventilator. And once somebody goes on a ventilator, the chances of coming off this with a favorable outcome is only 1 in 2, or even less.
Wow.
And so it is a very serious disease. Please take it with the seriousness that it deserves. That's all Madam President.
Thank you. So, I don't know if the public realizes how blessed we are to have you as our own medical advisor, right? We're really benefit from that wisdom and your experience. I'm a little concerned because I do follow social media, and I read comments that this is a hoax and that it's we're taking people's rights away and all of those kinds of things. And I guess I just want to encourage those who are listening to continue to practice social distancing. It is hard. I have to say, I'm getting kind of bored. We often think, wouldn't it be great to work at home every day? Well, it's wearing thin. I had a Zoom call today with some high school students who are involved in my Purdue Northwest youth program, and they were really agitated. And they as they discussed it, they were saying, we didn't realize how much we need social interaction, and that's kind of a human thing. We all being around people, being able to communicate and talk to people, whether it's on your morning walk or at the grocery store. And so it's hard for us to be apart, but it's the time to do so, and it's the time that's your contribution to your community, to be able to social distance as we are advised and required to do by our governor, by our president, and certainly by our local elected officials. It's what each of us can do, and so we ask people to continue to do it to reduce the spread. And it looks like it might be working, but it's too early to tell.
It is. Yes. Madam President, a couple of reminders to the public who are watching. First of all, frequent hand washing is still important because the spread happens from person to person. And initially they used to say 6 feet, but sometimes when somebody is speaking, some of the droplets can travel farther than that, so that's important. Wearing a mask in public, it's okay. As long as we have the pandemic, it's okay. I wear I get up every morning, I go out, I put on a mask, and it's there all day. And I've gotten used to it. Because you never know who is going to come to see me, so I have to be prepared. And so also everyone else. The other thing which a lot of people don't pay attention to is, like if we are in a public place and if we are touching certain objects, there may be a chance of infection from that. So after that, I think it's very important to either go and wash your hands for 20 seconds with soap and water, or use the gel. Yeah.
Thank you.
I think it's very, very important that we do that. The last thing I want to emphasize is, so that everybody can remember, is the acronym MEN, M-E-N. Avoid touching the mouth, the eyes, and the nose. Those are the three sources from which the infection goes inside. So avoid men.
No touching men is what I'm hearing. So, Dr. Gore, before we, Rich, you're on Zoom, but before we go, let's put on our masks so we're practicing good social distancing. So with that, the meeting is adjourned.
All right. Thank you.